Coming to you from the Mile High City, Denver, Colorado, I'm Jimmy.
And I'm Ashley. Welcome to our new psychedelic news show, Psyched for the Week.
Every episode, we will look at 4 news stories from the world of psychedelic medicine. We will cover the business, politics, science, and spirituality related to psychedelic medicine.
This week, we're psyched about researchers looking to psychedelics to treat healthcare workers, the next steps for psilocybin in Denver, Compass Pathways completing the largest psilocybin studies to date, and psychedelic businesses taking off amidst a culture clash. Jimmy, how are researchers looking to help healthcare workers with psychedelics?
Well, Ashley, the University of Washington School of Medicine will conduct a study to treat 30 medical professionals with a synthetic dose of psilocybin. The study aims to determine if using the drug along with therapy can reduce stress associated with healthcare jobs. During the past couple of years, the medical community has suffered with mental health issues related to the COVID pandemic. Many professionals have decided to leave the healthcare industry entirely because of the stress. A survey last year found that approximately 50% of healthcare workers felt burnt out and that 38% had experienced significant anxiety around their jobs. The study will enroll healthcare workers who are currently reporting some form of depression. Each of these participants will receive either a synthetic dose of psilocybin or a placebo combined with several sessions of traditional talk therapy. Results from previous studies have identified a significant amount of variance with subjects self-reporting results. The study has the benefit of compiling data from a group of healthcare workers who have a similar understanding of anxiety and how to rate it. They also have a scientific background to help ensure that protocols are followed properly. Of course, using psilocybin is still a legal gray area. For the study to be compliant, researchers had to gain approval from the U.S. Drug Enforcement Agency and receive a license from the Healthcare Department. It took researchers almost 9 months to obtain approval for the study. These small psilocybin studies have produced positive results, but with a sample size of only 30, it will most likely prohibit researchers from drawing definitive conclusions about the effectiveness of the trial. For more on how psilocybin may be advancing local mental health care, Ashley will be looking at the next steps for psilocybin decriminalization in the city of Denver.
2 years ago, Denver broke ground as the first city to decriminalize psilocybin mushrooms. In a November City Council meeting, the president of the panel tasked with reviewing the law made recommendations that could further ease Denver's magic mushroom laws. Kevin Matthews, president of the Denver's Psilocybin Mushroom Policy Review Panel, presented recommendations to the council's finance committee that could become part of a future bill. The panel advocates decriminalizing communal consumption and gifting or sharing of psilocybin mushrooms, training first responders like paramedics, cops, sheriffs, firefighters, and STAR program members on how to safely respond to a magic mushroom-induced crisis, and determining how psilocybin therapy could address mental health issues in Denver. Matthews announced the panel's unanimous declaration that decriminalization in Denver has not created any significant public health or safety issues in the city. In his presentation, Matthews noted that arrests for psilocybin were down 50%, with 89% involving other illicit substances. Psilocybin arrests accounted for less than 1% of drug felonies and misdemeanors in Denver. Denver City Council member Chris Hines praised Denver's national leadership on decriminalization. Since Denver voters voted to decriminalize psilocybin mushrooms, other cities like Oakland, Seattle, Washington, D.C., and recently Detroit have passed similar laws. While many cities are looking at the decriminalization of psychedelics, a major British company is looking at patenting synthetic psilocybin. Jimmy, what the
Compass Pathways is a publicly traded psychedelic medicine company based in the United Kingdom with major offices in New York and San Francisco. Researchers were investigating whether psilocybin could improve the outlooks of patients dealing with treatment-resistant depression. In the study, 233 participants who had previously been diagnosed with depression received 1 of 3 different sized doses of psilocybin. This is one of the largest psilocybin studies to date. While the initial results looked promising through week 12, there was a significant decline in improvement after 3 months. The concern around long-term results caused Compass's stock price to decline once again. Along with the mixed results from clinical trials, investors continue to speculate on whether Compass will maintain its patents on how to synthetically produce psilocybin. If Compass cannot maintain these patents, it may be difficult for the company to reach its expected earnings potential. Several parties have challenged the legality of patents owned by Compass, and there has also been a significant amount of turnover in upper management over the past year. Compass will continue to analyze the data as they prepare for Phase 3 trial. It is expected that Compass will meet with the Food and Drug Administration at the beginning of the year to work on the details of Phase 3 research. You can find more information for investing in Compass Pathways by searching the stock symbol CMPS. Ashley is now going to take a deeper dive into the business side of psychedelics.
This isn't the 60s again, Daddy-O. Psychedelic businesses are taking off. We're in the midst of an emerging culture clash between psychedelic activists and wealthy white men. Will psychedelics follow the path of legal cannabis? Experts interviewed by The Guardian signal the warning that psychedelics could fall into the arms of the pharmaceutical industry, making the rich richer. Drugs like psilocybin, ayahuasca, and DMT that have traditionally been associated with countercultures like hippies and ravers are now mainstream. Touted as the next big development in mental health care, psychedelic treatments for anxiety and depression is a new market expected to be worth $10.75 billion by 2027. 2 years ago, Denver broke ground by voting to decriminalize psilocybin mushrooms. Oakland and Santa Cruz, California, Oregon, and Seattle, Washington soon followed, adding ibogaine, mescaline, and ayahuasca. However, those profiting from this new industry may not uphold the values of the counterculture that popularized it. Much of the effort to legalize has been focused on undoing the damage done by the war on drugs. Investors in psychedelics have a different strategy: exclusive management of the industry. Jason Ortiz, Executive Director for Students for Sensible Drug Policy and co-founder of the Minority Cannabis Business Association, fears that institutionalization of psychedelic drugs will make them less accessible to the common person. He views Big Pharma as a threat to his efforts to decriminalize psychedelics and empower individuals to make their own choices. Joseph Tucker, the executive of Enveric Biosciences, argues that to do it the Big Pharma way will provide users with a more confident, better experience with fewer side effects. He warns that the biggest issue is having a bad trip, as well as serotonin syndrome and the cardiotoxic effects of taking psilocybin daily. As the U.S. prepares for drug law shifts, the battle between Big Pharma and activists ensues. Jason Ortiz points out that large investments in psychedelics aren't a bad thing. As long as people from all backgrounds of privilege have access to the substances, he remains optimistic, hoping equal access will dissolve the stigma around psychedelics and give mental health help to those in need.
Thanks so much for watching. If you liked what you saw here, be sure to give us a like and subscribe to the Psych for the Week YouTube channel. We will keep you updated with the latest news from the world of psychedelic medicine.
If you have a story you'd like us to cover, please let us know in the comment section below.
You can also follow us on other social media, including Instagram and TikTok. Links are listed below in the description. And as always,
stay safe,
stay informed,
and stay psyched for the week.